if I was turning 65 today, the first thing I would not do is start comparing Medicare plans. That sounds backwards, probably coming from somebody who helps Medicare, people with Medicare every single day. But lean in and hear me out. Before I even start talking about Medicare Advantage, Medicare supplements, Part D, all of that, I need to actually know, when do I need Medicare? So if I was turning 65, here's exactly how I would approach this. First, I will write down 2 dates, my 65th birth month and the date I actually plan to retire, because those might not always be the same date. And so if I'm retiring at 65, okay, now we need to build my Medicare timeline around that number, around that date. But if I'm 65 and I'm planning on still working, or my spouse is still working and I'm covered under their jobs coverage, then I'm not automatically assuming that I need to cancel everything and jump right into Medicare. That needs to be what is evaluated first. Then once I know when I need Part A and Part B, I start making coverage decisions. And really, you're choosing between two major paths, one being the original Medicare with an additional coverage like the Medicare Supplement Medigap plan and your Part D prescription drug plan, or receiving your Medicare benefits through a Medicare Advantage plan. Then I'm checking on my doctors, my prescriptions, how much do I usually use my health care, do I travel, what is my budget, and how much financial predictability do I want. That is the order. That is the order. That's how you build it. That's how you plan it. Because the biggest Medicare mistake is trying to answer question number 5 before you've answered question number 1. So if you're turning 65 and you feel like everybody's just throwing plans at you before you've even actually understood Medicare itself, that's exactly why I created my free webinar, How to Prepare for Medicare Before You Retire. So if you want access to that free webinar, comment 65 and I'll send you the information that you need. Talk soon.